Good evening, everyone, guys. Hope you can hear me. Yeah, can someone? Yeah, you can hear me. Perfect.
Yeah.
Thank you very much.
Yeah, we can hear you.
Right.
Yes, we can hear you. Excellent.
Right. Welcome you all to the Prep Medicos webinar on the FRCS Section 2 exams. So we will be having an informal kind of a formal and an informal kind of chat for the next 1 hour. I will be taking you through the what is expected in FRCS Section 2 exams, how a candidate appearing for the exam should choose the strategies for them preparing for the exams, etc. This is what we are going to be discussing in the next 1 to 1.5 hours. We have a lot of time at the end for question and answer session, and if you have any queries or doubts, feel free to put up in the chat, which we can discuss as well. So to introduce myself, I am Manikandan Katharvel. I'm a consultant HPV transplant surgeon working at the Whittington and the Royal Free Hospital, London. And I'm also the program director for the FRCS courses offered by the Prep Medico. And today's meeting is planned as a part of our 10th FRCS course, which is about to commence in the beginning of next month. So this is our 10th edition. So every course before we start, we used to have 1 or 2 sessions focusing on the FRCS Section 2 exams. Usually we focus on delivering taster viva sessions where people can come and engage themselves to understand how the vivas happen in the Section 2 exams. But this time, because there were plenty of requests to just give an overall orientation and about the FRCS Section 2 exams in general surgery, and also the key factors a candidate should consider before sitting to the exam and before starting their preparation for this exam. Most of you here might be taking your exams either in the September 2025 JCIE diet, or if you're international candidates, probably you might be taking exams in November 2025. I think most of you here would have registered for our upcoming course. However, this invitation was sent to everyone who are even thinking to take this exam or who are waiting to take this exam later in their career as well. So I have prepared my talk, and I will be delivering in a way that whatever I discuss here in the first half of the presentation would be a general orientation to the exams, and the later half I would be telling what we offer in the in this exam preparation. So without much delay, let me open my screen. If you have any doubts in between when I'm talking, or if you want to stop me and ask questions, please feel free to raise your hands, and then I can take it from there. Right. So I had given a topic like this, is it to prep smart and start strong. It's very, very important because unlike any other exams, again, based on my own personal experience, this exam is something which is quite very unique, which tests multiple strengths of a particular candidate in this exam. It's not just the knowledge, it's not just how you talk, it's not just professionalism, but it tests several things. So similarly, the curriculum or the syllabus required for clearing this exam is huge. Even if you have 1 year time to prepare for this exam, the day before the exam, you would tell that, there's a lot more I didn't study. I don't know how am I going to succeed. So that is the kind of this exam. So what is essential here is to prepare in a smart way rather than doing a very, very hard work. So that's why I had put as prep smart. And start strong, why I had put up is, it's again very, very essential before preparing for any exam to understand what is this exam all about and what they are expecting, so that you can prepare in a very, very focused way. Example, like, simple, I always compare this Section 2 exams like, a driving test, which happens in the UK, which is very, very strict. If you see there, however good you have been driving, doesn't matter. For this particular driving test, there are certain standards which you need to fulfill, and even a slightest error which you do, you don't get the license. Exactly the same as the Section 2 exams. You all, by the time if you are sitting here for this webinar, it indirectly tells me that, or tells yourself that you have been in the field of surgery for more than 10 years, and you have been practicing consultants, practicing senior trainees, practicing registrars. And without doubt, you would be able to manage any patient who comes under you. However, when it comes to this particular exam, this exam needs certain specific characteristics and qualifications which a candidate has to express. So understanding those things is very, very vital before you even start your preparation. And as I told before, this webinar is conducted as a part of prelims of our 10th course, which is about to start in the first week of June, and accredited by the Royal College of Surgeons of Edinburgh. So what are all our session objectives in the next 1 hour? So we will be discussing, or I will be taking you all through understanding the course structure of the Section 2 exams, as well as the expectations from a candidate in this exam. Second thing is to understand the mindset required by the candidate to succeed in this consultant level qualifying exam. I had intentionally put this consultant level because I always, so this is an exam which is giving you a license to become a consultant in the UK. So whatever tested here is to test whether you are ready to become a consultant or not. So that's why I put as a consultant level qualifying exam. And also to explore strategies for effective preparation, including time management, how you're going to adjust your available time, and how you are going to utilize your time in the exams as well. And also how to prioritize the curriculum. As I told, there's a huge curriculum for this exam. There is no limit of how much you would need to prepare. So how would you prioritize what you need to study and what you can keep it at the last? And then most importantly, we'll be spending a lot of time on what are the common reasons why a candidate fail in the exam. And based on those facts, we'll be discussing how you would prevent those important points or important reasons to succeed in your exam. And at the end, we'll be discussing how a candidate should choose what is the right strategy for yourself. So this is an exam, again, you cannot generalize all the trainees under one roof. So every trainee who is appearing for this exam will have their own individual strengths and weakness, and you need to know what is your strength and what is your weakness, and you need to identify or curate a plan which is suitable for you. You cannot take someone else's plan and you adapt for yourself. And lastly, as I told, to develop a personalized and a structured approach towards passing this exam. So the ultimate goal of this webinar is everyone who attends this session should have a clear mindset and should follow a clear training path so that you clear your exams in the first attempt. This is not an exam where you do a trial and error, because the amount of effort which you put for preparing for the exam is enormous. You need to sacrifice a lot of your time. You need to sacrifice a lot of your clinical work. You need to sacrifice a lot of your family time, because everyone would be busy with your family and kids. So after sacrificing all these things for 3 months, if you don't clear the exam, that is the biggest painful thing in this exam. Yeah. So coming back again and preparing for the exam is a big pain. So you do everything well in ahead, plan properly, do everything in one go, and clear this exam in one go. So my talk will be focusing on that, how you clear this exam in your first attempt. So now moving on to session agenda. So what am I going to cover? How will be proceeding through the topic would be, first of all, I would like to set a platform for you all to understand this exam based on the cumulative results of the JCIE exams, which is available in the JCIE website. So I'll be putting up the results of what is the exam results expected in this. Then we will discuss about the common reasons for failure. Then let's go into in-depth about the understanding the exam, preparing the strategy, and finally, as I told, how we as a team Prep Medico have been doing this kind of a training for the last 4 years, and what we have achieved in numbers. So this is what I'm going to talk. And lastly, we will have some Q&A time. Right. Let's start with the first agenda. So let us analyze the results of the exam in the last 10 to 12 years. Yeah. So I'm going to put up the cumulative results of the UK JCIE exam and the international FRCS exam results. So this is a PDF which I have taken from the JCIE website. Don't get so confused, but I'm going to mark and show you. So whatever I have highlighted here is the past results of UK trainees. Okay, when I say UK trainees, these are candidates who had done their full surgical training in the UK, starting from 2009, and it's going to 2016. And I have the next page coming in the next slide. So you can see the overall pass percentage for a UK trainee starting from 2009 is always good. It's around 80 to 85 percentage. But you can see here, this is the pass percentage of candidates giving this UK-based JCIE exams, but who were not trained in the UK. So this is like immigrants who come from outside in any other part of the world, coming into UK, starting their surgical training or surgical career as an SHO or a junior registrar or a senior clinical fellow or a junior clinical fellow, but you had not taken an structured training program in the UK. So this is the results. You can see here the results of a UK non-trainee in the JCIE exam have always been less than 40%, starting from 2009. Same in continuing. So starting from Feb 2017 to September 2024, you can see the results of the UK trainees were always above 85%, but the non-trainees on an average is very, very poor. This includes all the attempts. You know that the Section 2 exams, you have in total of 4 attempts you can take. Irrespective of the number of attempts, this is the pass percentage. So overall, in the last, if you take a cumulative average in the last, say, 12 years or 14 years, the overall pass percentage for a UK trainee is around 88%, while a UK non-trainee is 45%, irrespective of whatever attempts you are making. So this is the state of the JCIE exam or the UK-based exams. Moving on to the international exams, the JSCFE exams. So JSCFE exams, they were conducting, in a very haphazard fashion. In the last 2 years, there was only one exams. Before that, in COVID, they didn't have any exams. But if you see overall, starting from 2013, the past results were around 48, 35%, 47%, again, irrespective of your number of your attempts. Only in the last 3 years, starting from 2022, the pass percentage has slightly gone up. I can proudly take some of the credit from here, because starting from March 2022, almost half of these candidates giving this exam were our course candidates, and we were able to produce the results because we were training them exactly like the UK candidates, and this is the pass percentage. So what does these results tell you? What does the result of the JCIE exam or the JCFE exam tells you? Is obviously UK trainees consistently have a very high pass rate, while UK non-trainees sitting in the UK exams or the international candidates have an average chance of passing this exam by less than 50%. So this is an exam which is specifically curated for the UK-based curriculum and UK-based training pathways. I am insisting this very clearly because I have always seen several international candidates, after failing the exam, they come and tell me that I was a gold medalist in the, say, a super specialty exam in India. I was a super specialty, I'm a gold medalist in an exam which happened in Europe or in US. Okay, so however good or however best you were in your level, in your country, this is an exam which is completely different from whatever exams you have been giving in your country, and this particular exam needs a separate preparation if you are not trained in the UK. So this is the first understanding you need to take. So being a non-trainee in the UK or being an international candidate in the giving this exam, you have an inherent disadvantage that you need to prepare at least twice more than what an UK trainee would be preparing for this exam. Again, I'm stressing this a lot because I know most of the people who are sitting here may not be the UK trainees. I know few of you are UK trainees, but still I am telling this in a generalized fashion to know that. So this understanding is very, very important. So this tells you how how are these exam results, and how I would not use the word difficult here, because these exams, I will never tell that these are all difficult exams. Yeah, even though the pass percentage is less than 50%, I can very strongly tell that the difficulty is not because the candidate had poor knowledge or anything. It is mainly because they didn't understand this exam. That's what I would say. So from with this background, let us jump into some of the common reasons for failure. If you go and talk to candidates who have been failing repeatedly, okay, failed 2 times, failed 3 times, or failed on the first time, the common words which comes from their mouth are these things. They will tell that I thought I did everything right, I still failed. Some people blame the examiners. They tell that from the beginning, every examiner was impartial to me. They were extremely rude to me. They decided upfront only that they don't want to pass me. Some will tell that I was sure I passed. They even seemed friendly, but still I failed. Some will tell that 3 times I have failed. I have attended all the courses. I have gone through all the books. I don't know what more I can do, but I'm still failing. And then some tell that the way they looked at me, they felt very unfair. And some tell that this exam, you don't need to prepare at all. It's only luck. If you have luck, you will pass. If you don't have luck, you will fail. These are the common words which we get from candidates who repeatedly fail, or even people who fail. But I need to tell you that this is an exam which has been happening over several decades, and this exam has been refined in several ways, and this is a time-tested exam. And the curriculum of the exam, the way the exam is conducted, the way the candidates are tested, and the way marks are provided has gone through several revisions, and you don't need to have any doubt that this is one of the highest standard of exams in the field of surgery. That's why the FRCS degree holds very, very high in the field of surgery. So the reason why people fail is because they are not weak, but it's simply because they don't understand what this exam truly demands. That's the most common reason for failure. Okay, you so tomorrow you before so that's one of the important exercise any one of you should do before you start your preparation. Go and speak to people who had passed the exam. Go and speak to people who had failed the exam and get their mindset on why they failed. That's the first important thing. Everyone have to do an exercise before you jump into your preparation. So everyone thinks that the knowledge is the main thing which is assessed in the exam, and people tell that if you don't have knowledge, you will fail. That's not the actual thing. Apart from knowledge, in my view, the knowledge required for this exam is only 50%. If you have knowledge, good knowledge, there is only 50% chance that you will pass. Okay, still you will have 50% chance you will fail. So by virtue of you all sitting here or having cleared your section 1 exams, I can tell you very clearly at this point, every one of you have enough knowledge to appear for this exam even tomorrow. You all have this knowledge. But what else are important is all these things. So however good knowledge you have, if you are not professional in the way you think, in the way you behave, in the way you speak, you will fail this exam. If you are unable to verbalize your thought process clearly to the examiner, you will fail. If you are unable to verbalize the thought process within the given time, so when we go down the slides, I will be telling the pattern of this exam. So all these exams are very, very intense, short exams. So you will have a 5 minutes where you need to prove yourself. What do you know about, say, a pseudomyxoma peritoni? You will have 5 minutes to tell what do you know about management of colorectal liver metastasis. You will have 5 minutes in dealing with a patient who's having a complex cardiac background. So in this 5 minutes, you need to prove what you have read so far or what you have handled so far to the examiner. So that's where the time management comes. So that's again one of the most common reasons for failure. People will have knowledge. People will be very professional, very mature. People will be able to talk, but they will not be able to talk in a pace which is needed to prove all the knowledge whatever you have. So that's again second important point. Another important reason for failure is not knowing your limits. So especially this happens with many of the immigrant doctors who have been practicing surgery elsewhere, where you have been doing all the surgeries by yourself. You come here and you talk, say for example, you being a colorectal surgeon, and you have a patient coming to you with a breast abscess, or you have a patient coming to you with a breast lump. So you should know that you as a colorectal surgeon you should know what limit or what extent you can go in the other specialties. So in this exam, the importance is given to more importance is given to your unsafe responses rather than a safe response. So even however good you do in your viva, when you tell one unsafe answer, okay, or if you tell one response which would be considered as a serious harm to the patient, you will be marked fail. One of the unsafe responses, you as a colorectal person going and evaluating and treating a patient with breast lump, or going and evaluating and treating something where a specialist breast surgeon is available to sort this out. That is considered as unsafe. So another important thing here is you need to unlearn many things. Especially this is common with immigrants. You need to come here when you are preparing for this exam. You need to unlearn certain things, and you should not tell certain things in the exam. You should pick up the point, identify the seriousness, refer this patient to the appropriate specialty. That's another important thing. Not knowing your limits is also a common reason for failure. Making safe decisions. As I told, any unsafe response, any unsafe decision you take for a patient will be marked fail. Yeah. And lastly, they also test how you sit in the exam, how is your facial expression, whether you have a proper eye contact or not. Again, all these things are tested. And if you lack any of these things, you will fail in the exam. And these are the common reasons for failure. By and large, so overall, you should be behaving like a responsible and a safe consultant. So this is what is the overall quality a candidate should have before appearing for the exam. So let us move on to understanding what is this exam then. So this is, in my view, it is just a consultant interview. Yeah. So assume that this is an exam where you are appearing appearing for a consultant interview to become a consultant in the UK. Again, for immigrants or people from other non-UK people for whom you need to know, a consultant in the UK usually will have at least 10 to 12 years of surgical training. It's not like a short period of training which we have in other. For example, in India, I know that when you finish 3 years of surgical training, you become a general surgery consultant. You finish 6 years of surgical training, you become a consultant in a specialty. But it doesn't work like that in the UK. So in the UK, to become a consultant, an average training period of close to 10 years is needed. Only then you will be eligible to become a consultant. So your answers in the exam should be similar to a person who have been trained for more than 10 years in surgery. So that is the level of knowledge, that's the level of responsibility, that's the level of decision-making skills you need for appearing for this exam. So this is a consultant interview where two people are sitting in front of you and deciding whether you are a candidate to become their colleague in their trust as a consultant. This is what they are assessing. So how it is assessed, it is done based on multiple viva sessions. Yeah. For if you are a candidate giving the JCIE exams, which is the UK exams, there will be 6 vivas which you will be going through. So out of 6 vivas, you will have 2 clinical examination vivas. One of the clinical examination viva will be in general surgery, and the second clinical viva will be on your specialty. So for international candidates, just to let you know, for the UK candidates, they need to choose their specialty. Yeah. So you will have 40 minutes of discussion in general surgery, 40 minutes of discussion in your specialty. And within this, you have 2 short cases and 1 long case each. And each of these interviews or each of these vivas, you'll be having 2 examiners sitting in front of you. And these 2 examiners, one of them will be questioning you, the other person will be marking you. So this is 2 out of the 6 vivas. The other 4 vivas will happen for 30 minutes each. In this 30 minutes, you'll be having 6 scenarios. This is what I told. So in the 30 minutes, each candidate will be questioned on 6 clinical scenarios, and in each 5 minutes you will be asked close to 10 questions. So this is where your verbalization matters. So you have to train yourself in a way that when a question is asked, you need to answer precisely, not taking too much time to the question asked. You need to know what to answer, what to talk, what not to talk. This comes with a practice, and this comes with a proper training. Again, the 4 Viva sessions includes emergency trauma critical care, general surgery principles. You will have Vivas in your special interest, as well as for UK candidates, you will have a basic science station along with an academic paper interpretation. So these are all the 6 modules a candidate will be going through in the JCIE exam. 2 clinical examination, each of which is 40 minutes, and 4 Viva stations, each of which is 30 minutes. And within each 30 minutes, you will be having 6 scenarios, each for 5 minutes, including an academic paper, which will be given to you 30 minutes prior to your exam, and you will be presenting and critiquing a manuscript for 15 minutes. If you are an international candidate, so these are all your Vivas. Okay, I'm not going in detail. All these things you would have seen in the website. So you will have a general surgery clinical where you will have 4 scenarios, then general surgery clinical 2, again 4 scenarios. You have emergency surgery Viva, general surgery, trauma, and critical care. So this is something. So these are all the areas where interviews happen. Each station or each interview, you'll have 2 examiners, and this is all time tested, and these scenarios will run like a rapid fire round. Now, the important question is what all are assessed. So this is again very, very important so that you can prepare yourself in how to prepare for this exam. So I'm going to show the marking descriptors. Okay. So each of the examiner is given a marking descriptor to put marks for each of your responses. Whatever question is asked to you, your marks will be assessed based on all these characteristics. Okay, starting from your overall professional capability, which includes your personal qualities, professionalism and ethics, surgical experience, adaptability to stress, ability to deal with gray areas. So these are all the things which will be assessed in your professional capability module. Your knowledge and judgment will be based on your core knowledge, ability to justify whatever answers you have told, clinical reasoning. They also check how you communicate, and they also check how you organize your thoughts and putting out as a logical explanation. And lastly, how you deal with the real patients who will be exposed in the exam. So this is the marking descriptor, and I want every one of you, even before preparing for the exam, to take and print this marking descriptor to understand how each of your response, any question you answer, it will be assessed based on all these categories to give a mark. So this is the actual marking descriptor which is given to the examiners. Each of your answers will be marked from a score between 4 to 8. Okay, 4 and 5 is fail, 6, 7, 8 is pass. Okay, this is available in the website. You can see you will be given a mark of 4 if you had presented like this. So 4, if they give a mark of 4, you have failed. A mark of 5 is fail, and these are all. This is how they will mark if you are given 6, 7, 8. For example, if you are expecting your examiner to give you full mark, you should have demonstrated the ability and the confidence. So very significantly above the level of competence. When you say above the level of competence, you should have an above the consultant level confidence, and you should have a characteristic in a way that you are at ease of making a higher order thinking. You have flawless knowledge plus insight and judgment. You have a good understanding of the breadth and the depth of the topic quoted from literature. You are a high flyer and a strong interpretation and judgment of whatever you talk. Okay. Similarly, the answer, the question level which you have reached in the Viva would have gone to a point where you are discussing about latest trials and evidences. Your answers are very confident, very clear, logical, and focused, and there were no prompt necessary from the examiner. The examiner just listens to you. and you have an exceptional communication relationship with the patient care. When you demonstrate all these characteristics in every answer you make, you will get the maximum mark. Okay, so you all should go through this. Okay, and if you want to have a real life details about this, I have written a blog on this, giving examples of, I have given a question and I have given a candidate answer and how each answer would be scored. So according to you, for example, a simple question is, say the examiner is asking you, a patient, this is an elderly patient coming to you with a strangulated femoral hernia, what would you like to do? So if you answer like, okay, I would like to take this patient to surgery and want to do an open repair, that's a fail actually. Although according to you, the answer is right, but in the exam, that's a fail mark. So how will you get a full mark is, I would first of all consent this patient. I will follow the Montgomery principle, explaining whatever is the options for the patient. I will make sure this is an appropriate candidate. I will do a WHO checklist to make sure I'm doing the right thing for the right patient. And then in doing the surgery, based on the European Hernia Society guidelines, I would do a diagnostic laparoscopy to start with and then perform this operation. So when you answer like this, so if you compare the answer which I told before and this, according to you, you answered the right answer, but you were marked fail. So this is how many of the candidates, they believe that they told all the right answers, but still they are failing. So that is because you don't understand what is expected in this exam. So that's very, very important. And I urge every one of you to go through this paper. And I will also share the blog which I've written, where you can go through that and you can understand what is expected in this exam. Right. Coming back to the same, now you would understand why I am telling this, where you need all these things, all these skills for clearing this exam. Overall, you should behave like a consultant who is ready to take up a consultant job tomorrow. That's what is expected. So what is expected is, you should behave like a day one consultant. You should answer like a day one consultant. Okay. So in the exam, whatever question is asked, you will not be answering like a registrar. You will not be answering like an MRCS candidate. You will be answering in a way that this patient is under you. You are the consultant in charge for this patient, and you are taking decision with an experience of a first day consultant. This is what you need to tell. So you would tell, say, if you have a very complex scenario, okay, and you are a day one consultant, you would tell that as a day one consultant, I will not touch this. I would do this. I will offer the patient these options. I will speak to the medical director and I will explain my concerns. So this is how you need to answer. As I told, for passing this exam, knowledge constitutes 50%. The rest of the 50% are all the other characteristics which I told, whether it is a JCIE exam or the JCFE exam. And the examination is like a mutual interview rather than a question and answer fashion. So you will be sitting there discussing with two colleague consultants, and the discussions all will be in a way that you are discussing a complex scenario, where most of the scenarios will not have a single right answer. Most of the questions asked in the exam will have multiple options, and what they check is how you choose which option and justify. So these discussions has to be mature, and you need to discuss with these colleagues, thinking that you are their colleague rather than they are big examiners and you are a candidate sitting in front of the exam. You will be treated with respect. It's always a two-way conversation and not like an MRCS examiner. The exam, this is again, I'm telling specifically for the international candidates. And the assessment is based on how you think, how you process your thought process, how you react to the scenario, rather than just telling the correct answer. This is the example which I told. For a strangulated femoral hernia, the correct answer is you will operate. But that is not expected here. What is expected is how you think, how you process, how you take this patient to theater, how you safely deliver this surgery to the patient. That is what is tested. Many of the questions in this exam will not have a single right answer. Most of the questions will have multiple options, okay? And you will choose what is right for this particular patient based on your experience, based on the latest evidences, okay? So that is what is expected. And Again, you will have, so I have put this line because during the peri-COVID time, we were not having real patients, but for the last 2 to 3 years, we actually have real patients, whether it is a JCIE exam or JSCFE exam. You have either real patients or you might have actors from whom you need to get history from. Okay. Similarly, you need to know the latest evidences, latest guidelines, and the practices followed in the NHS in the United Kingdom. This is again the key, and this is again the difficult part for immigrants who come here who have never practiced in the UK, and also for the international candidates. You have no excuse rather than sitting down and going through all the guidelines practiced in the UK. What is the common practice in the UK? What are all the latest evidence-based practice for at least the common general surgery? You will not be able to know for everything, but you should be able to know the evidence-based practice in your specialty. You should know the evidence-based practice for the common general surgical problems. And most importantly, you need to tell your answers in a structured way. You cannot be blabbering there. You cannot be wasting time there. And you need to tell answers completely. As I told, more the prompts coming from the examiner, lesser will be your marks. You don't want the examiner asking you repeatedly, what else? What next? Are you sure? We don't want these responses from the examiner. The examiner should tell, okay, thank you, let's move on to the next question. This is what is expected in the exam. And many situations, you will be pushed into a scenario where you would have never seen or heard before. This is again a problem for UK trainees themselves. This is what I would say. So UK trainees, unfortunately, beyond ST6, you would have spent most of your time in your specialities, and you wouldn't have any time, say, seeing a transplant patient or a vascular patient or an endocrine patient. However, those patients will be brought in front of you in this exam. So you will be having, say, a colorectal trainee who has never seen a single liver transplant patient would be asked in a long case, telling that, okay, you have a patient who is sitting in front of you who had 2 liver transplants before, coming now with weight loss. How will you assess this patient? This was a long case. I'm not joking. This was a long case for general surgery trainee in the last exam. Okay, so you will be pushed into unfamiliar situations, but what they are testing is, you don't need to know what was the transplant, you don't need to know the intricate knowledge required in transplant, but what is expected is, how do you safely handle this patient? How do you safely diagnose the problem, and how do you safely refer this patient? So you need to know a minimum level of knowledge in all your unfamiliar territories with the standards practiced in the NHS. This is the curriculum which is given by the JCIE regarding the level of knowledge you need for this exam. Let's leave the section 1. Let's go to section 2, which is our core discussion. So again, this is mainly for UK JCIE exams. I would say for the JSCFE exam or the international candidates, it's almost the same. Yeah. For the JCIE exams, you should have, when I say ST8, it's a consultant level knowledge. So you should have a consultant level knowledge in general surgery, critical care, and your specialty, whatever specialty you are. You should have an ST6 level knowledge in upper GI, HPB, and colorectal. And you should have an ST4 level knowledge in transplant, breast, endocrine, and vascular. Even though this has been given like this, if you go back and see speak to your colleagues, what questions they have asked, they have never followed this. Okay, in my view, every one of you giving this exam should have a consultant level knowledge in general surgery, emergency, upper GI, HPB, colorectal, irrespective of whatever is your specialty. You should have a consultant level knowledge in your specialty, and you should have an ST6 level knowledge in other specialties. So this is the level of knowledge I would say is required for this exam. I want to tell you one more important fact, that there is no limit of knowledge required. As I told, in other words, they can ask you anything. You cannot go there, in no way or on no day you will tell that, oh, this is out of syllabus, oh, this is out of curriculum. Nothing like that. Anything could be asked in this exam. So more and more you know in terms of knowledge, more and more better placed you would be in giving this exams confidently. Okay, so this is the level of, so when it comes to the international candidates, I would say you need to have a consultant level, because in the international level, international exams are mainly on general surgery. You don't have any subspecialty. You need to have a consultant level knowledge in general surgery, emergency, upper GI HPB, and colorectal. The all other areas, I would say, even if you don't have a consultant level knowledge, that's fine. Yeah. So this is again a very important slide. All the exam takers should know. Now, having known what is this exam, we have discussed about the results of this exam based on the statistics provided by the examining bodies. We went through roughly what is expected in this exam. We went through the curriculum. So now I think most of you would know where you are at this point when I say, what is this exam? Now, the next important thing is, say, if you are a candidate giving exam in September or November, you need to know how you are going to prepare for this exam. That's the most important thing. Again, this is something which many of you fail and regret 1 month prior to the exam or after failing in the exam. Okay. Few things which I want to tell you is, as I told in the beginning, if you go and speak to a candidate who has cleared this exam in the first attempt, he would tell that this is the most easiest exam he has ever faced in his life. He will tell that. And he will tell that he had prepared this exam in 1 week. Someone would tell, I just studied for 3 weeks. Yeah. So that's not true. Okay. You need to speak to 10 different people who has 10 different skills. You should speak to a UK trainee who has fluency in talking, fluency in putting himself forward. You need to speak to an immigrant doctor who shies away. You should speak to a person, an immigrant doctor who is very strong surgically but cannot talk. You should speak to a UK trainee who is an person. You should speak to people who have failed. Okay. Overall, from our experience in mentoring candidates in the last 4 years, we have handled more than 300 candidates so far. This is an exam which needs lot of time for preparation. Again, I am talking considering an average candidate. I am not talking about an extraordinary candidate. I am not talking about the weakest candidate. If you see, if we put a curve, I would say for 50 or 75 percentage of the people who are preparing for this exam, I would say you need minimum of 3 to 5 months of intense preparation for this exam. Okay. And another important thing is, don't go and speak to a person who has passed the exam and take his views straight away. Yeah. You speak to different people and identify which is the right preparation strategy for you. So how do you prepare? How do you take the right strategy? So I categorize this into different steps. So step one is understand the seriousness. Okay, so which we have understood so far. Whatever we have discussed, I think I had made the scene very, very serious for you all, and I have told you that this is a very, very serious exam, and this is a very, very vital exam in your career as well. Most of you would accept that, and this is a very, very vital exam for you to progress in your career as well. So the seriousness is set already, and you need to understand the seriousness of the exam. When I say seriousness of the exam, you need to understand what is expected in this exam, which we have discussed so far. The second important step is self-reflection. This is the most important thing which you all need to do now if you are sitting exams in September. Self-reflection is something where you need to know who you are and what is best for you. We will discuss in detail when I come to that particular slide. Once you self-reflect yourself, the step three is identify the strategy for yourself. Don't go with anyone else's plan. You identify the strategy for yourself. Most important time is you need to give enough time. If you think that you can prepare this exam in 3 months, give yourself 6 months. Okay. If you think that 2 hours per day is enough for preparing for this exam, give 3 hours. Okay. So as you go close to the exam, you will understand what all you have missed when you started your preparation 3 months back. So I would say this step four, give the maximum possible time. Dedicate this month mainly for your priority when you're preparing for this exam should be this exam alone. Your priority is not learning surgery. Your priority is not, you know, um, going for a, going with friends to a pub or going for a show or going on a vacation. So this 3 months you dedicate for your exams. Whatever free time you have apart from your exam preparation, you can dedicate for everything else. You should not be allocating time from other activities to study. That's very, very important. So you put in all your time, all your energy, all your money. I will tell you why I'm telling about money, which comes later. Okay, now, so that you pass your exam straight away. As I told, the most painful situation is failing the exam and regretting, thinking, oh, I didn't do this properly. I should have allocated more time. I didn't take this exam seriously. I thought this exam is as simple like this, but this is a completely a different exam. We don't want that. And once you start your preparation, every now and then you need to pick up your weaknesses and work on your weaknesses rather than sharpening your strengths. This is something which I see with candidates. So if someone is very, very strong in their specialty, they will be going and preparing and answering their specialty alone. They will not concentrate on the other areas. And they will tell that, oh, that area is weak. I have omitted it. No. So this exam, you need to cover everything. So identify your weakness, identify your, an uncomfortable area of the exam, and put yourself in that situation. Okay, you need to sharpen your weaknesses. You need to identify your weakness continuously until the exam, and without doubt you will succeed. As I told, if you follow this strategy, this is an easy exam to pass. Okay, as I told, you all have the knowledge by this point of time, even if you give this exam tomorrow. But what is needed is the other aspects and the proper smart planning. So we discussed about the seriousness of this exam. So time is the most important factor. In my view, 3 to 6 months is the minimum time with complete commitment and dedication for this exam. Speak to people with different skills, as I told, to understand what problems they faced and what did they do. And step one, you identify what all resources you have to play with. Okay, you need to know, okay, there are these courses available, these books are available, these podcasts are available, these YouTube channels are available, this kind of educational activities are happening with various educational sectors are available. So these are the things you should have in hand before even you start. Then, as I told, listen and read to the various blogs. So there are several groups within the UK who are doing a training for the FRCS exams, and each one of them have different, blogs written up, different educational videos which are put up, different candidate experience videos are there. Go through that to see and understand this exam. And also, step one, you need to know, looking at your next 6 months, you need to know what is your clinical schedule. Yeah, you should not be having your ARCP or an appraisal coming within the next 2 months and you prepare for this exam also. That's very, very important. You need to know what is your next clinical schedules coming up and see if you can fit your exam preparation with that. As I told, if you start preparing for this exam, preparing for this exam should be your top priority. Okay, nothing else. Okay, and finally, once you have all this, fix a date for the exam. I think I know that most of you here would be giving your September exams, but again, I'm just telling you by and large. The second important thing is self-reflection. You need to know what is your strength. Out of 7 or 8 qualities which are assessed in this exam, starting from knowledge, professionalism, verbalization, your body language, decision making, overall, you need to know which is your strength, which is your weakness. Again, from my personal experience, I always found the immigrants who come here and give this exam, their strengths are their knowledge, because they usually come from a place where they would have handled lots and lots of patients, and with all the specialities, your knowledge will be very, very strong. Your practical knowledge and your surgical knowledge would be very, very strong, but your weakness is talking or the language itself. Many of you here, you may not have English as your first language even. Unfortunately, here you need to be very proficient in English to curtail the time which is provided to prove who you are. Okay, so on the other hand, for UK trainees, what I have seen is basically they will be, because they are in the system, they know very well how these examinations are, what is expected in this exam, because they'll be going through the same kind of evaluation year by year. But what they lack is the knowledge. Again, because the way the system is arranged, most of your last 3 or 4 years before appearing for this exam, you would have spent purely in your specialty and not in other areas which is assessed in the exam. So for you, the weakness would be the knowledge. So the step one is you need to identify your strength and identify your modifiable weaknesses as which is required for this exam. If you think that you are a person who cannot talk, then that is your weakness. Your entire focus for your preparation should be on talking. No point you knowing that your knowledge is good, sitting with the book, study for 3 months, go to the exam and failing. You need to spend your time talking or practicing. Okay. And again, based on your strengths and weakness, you should have a realistic expectation. You cannot be thinking that, okay, I have knowledge, I cannot talk, but I think I can still pass the exam, let me go and give the exam. No, that's a waste of your time, waste of your energy, more than anything, waste of money. These exams are extremely costly, very, very costly exams. And the amount of money you will be spending on preparing for this exam in the direct and the indirect expenses still is too much. Okay, so you should have a realistic expectation on when you would be ready for this exam, when you would have time to put up this much time to prepare for this exam. If you really think that September is too short for us, this is the time you think that, okay, let me put it in February, let me start now, go slow. Okay, and identify the ways to correct the weakness. So this is how you choose what resource you would use for your preparation. Once you have your weaknesses, there are several resources available to choose your training path, but based on your reflection, your weakness, you choose. So the next important thing is planning a smart strategy, give enough time and things. So this is where you will be choosing what resources will be apt for you. So let me quickly go through the available resources to my knowledge. Okay, starting from textbooks. Okay, there are several companion series textbooks which most of you would know for all the specialty, which once upon a time was claimed to be the minimum basic textbook which is required for this exam. However, I don't believe that, because the knowledge which is assessed in this exam is far beyond whatever is given in these books. So although this book is still claimed to be one of the basic book for this exam. So this is some textbook available. There are several Viva books available. You have the companion cases, you have the cracking the intercollegiate Viva books, you have this is a new book which is a comprehensive Viva's book. There are some, and I don't know, there might be n number of unpublished Viva books available as well. So these are books which gives you scenarios with questions and answers. I am a guy who is very, very fond of listening to podcasts. So when I was preparing for the exam for 6 years back, whenever I was traveling, I used to listen to podcasts. There are several podcasts which will be very, very useful for this exam. As I told, in this exam, more and more knowledge you have, more and more stronger position you are in clearing this exam. So you should try to utilize all the different modalities of gaining the knowledge. One is through studying the textbook. Second is going through the Viva books. Third is these podcasts. There are several podcasts which are available. One is the Behind the Knife podcast, First Incision, Studying for FRCS podcast, ASGBI podcast, Royal College of Surgeons podcast, CENMARKS podcast. So these are all one of the very good podcasts in general surgery, which I had listened to and have got very good reviews from colleagues who had prepared for this exam as well. So this is something which is available. And when you go back, there are several national organizations like the ASIT, Duke's Club, the Rue Group, the Herrick Society, the Mammary Fold, TUGS. These are all different societies of various specialties who now and then conduct FRCS teaching, FRCS focused vivas, etc. And this is available throughout the year, which you will know. Apart from that, there are specific courses available for the exams. Again, these courses, I would classify them into two groups. One is intense revision courses, and other one is mentorship programs. The intense revision courses are the most common types of courses where twice or thrice a year, there are some standard groups which conduct courses where you will have 1 week course which starts from 8 o'clock in the morning, finishes at 8 in the night. You go there, You will be allocated in different vivas. You will be attending vivas. These are all very, very intense revision courses. When I say revision courses, you need to go to these courses once you are fully prepared. You are not going there to learn. You go there prepared, answer, refine your techniques, identify what's your mistake, and come out. These are all the revision courses, and most of you would know these are all the standard revision courses for general surgery available in UK. Whips Cross, very standard course, Alpine course, Doctors Academy courses there, Christie courses there. These are all revision courses. Again, these courses before the COVID era, they were all conducted as face-to-face, but now all these are conducted as online courses. The second one, which I was talking about, is the mentorship program, which is where we come in. Okay, so this is something which we started 4 years back, based on our own experiences, on what we faced as a group of few of the consultants. Now, when we were trainees 5 years back, we had attended all the courses, and we identified what is good in these courses and what is actually needed for the candidates, and we came up with a different kind of a setup, which is a mentorship program, which is what we offer, which I will tell a glimpse towards the end of this talk. I'll be finishing my talk in the next 10 minutes, okay? So don't get bored, yeah? So now I have told what are all the resources available in your hand. We have discussed about textbooks, Viva books, podcasts, various meetings, various courses. Whatever is available, the most important thing is your commitment, okay? So you need to sit and practice. When I say practice, you need to sit and you need to talk. There's no point in going to a course where you go and listen to what others say. There's no point in attending an organization's FRCS teaching where you just see and listen what they are doing. That's not going to help you at all. As I told, you have the knowledge already. What is essential is how to apply this knowledge and how to verbalize this knowledge. When I say practice, 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 identify the resources which will help you ticking the boxes which I told. The initial resources, textbooks and Viva books, there's no excuse. You need to do those for building your knowledge. But all other resources, whichever I told, the organizations, various courses, you need to identify where you will do lots and lots of practice. You will be monitored adequately, and you will be told clearly what is your mistake. Okay, this could come through these courses or through practice groups. You can have 3 or 4 of you in different specialties, and each one of you can question yourself and identify what is right and what is wrong. The simple thing is you need to open your mouth and talk. Okay, and 100% commitment. You cannot take any of these things seriously, and I can assure you, if you don't take seriously, you will regret. And as I told, self-reflection. So as you go through your preparation, in a week's time, you will feel very, very depressed. You will feel very overwhelmed looking at so much to study, so much to deliver your clinical things. But you need to sit calm and say, okay, whatever is the best possible effort you can put, you put. That's all. There is no compromise on what effort you can put. So you put that and you see what is your weakness and work on that. And this weakness can be told by yourself, your colleagues, your mentors, or people whom you are practicing with. Again, practice groups, very important. So in our course, whenever I say, we meet the candidates twice in a week, but day one, I tell that from today onwards, every one of you should form a small group, and every day night for 2 hours, you all come virtually and you need to answer to each other. It needs to be an everyday practice, at least for 3 months before your actual exam. And mentorship. When I say mentorship, speak to people who has recently passed the exam. In the last 2 diets, whoever has passed to the exam, speak to them, get their help, and see what helped them. You can ask them to question you so that they will have the fresh level of knowledge, and they can question you and they can correct you. And speak to people who are in the field of teaching for FRCS exams. I know that this is a consultant level exam. Any consultant in the UK would have cleared the FRCS exam. However, if they are not actually involved in teaching, they will not know the intensity of the exam. or they would have lost touch on the intensity of the exam. They wouldn't have updated the enough information needed. So speak to your seniors who are involved in teaching, involved in mentoring, rather than randomly asking some consultant to question you, which is not going to add any value to you. Okay. And as I told, invest everything now, identify your weakness early and work on that. Another important thing which I want to tell is, if you are a candidate giving exams the next 3 or 4 months, make sure you attend all the MDTs. That's very, very important. Okay. Multidisciplinary team meetings are the important areas where all the scenarios are taken for the exam. So you need to sit, irrespective of whatever is your specialty. If you know there's an endocrine MDT is happening, go and sit there, listen to the questions and listen to how things are being discussed, how a decision is made. Similarly, that is the place where you will be seeing all the unique X-rays and CT scans. You will have a radiologist who will be able to tell you the important findings. So as I told, once you decide what is your weakness with the various available resources, choose what is right for you, continuously reflect on your performance, correct your weakness. Without doubt, you will succeed the exam. But all these exercises are needed. Okay. I might sound very dramatic. Okay. You don't need to take these things seriously. But I'm stressing this in a very dramatic and in a very scary way, or in a very serious way, mainly because you all should take this very, very seriously. Okay. Or else you would regret. Again, this is something which we are telling based on our own experience. Okay. So with this background, so far whatever I have chatted is about this exam, how to choose your strategy. For the next 5 minutes, I'm going to talk about what we have been doing as a team Prep Medico in FRCS mentoring. Okay, so the Prep Medico courses actually started by a group of 6 consultants, which has now grown up to 40 consultants in the last 4 years. And at the moment, we are still not finished. The 9th course is happening at the moment, and we are planning to start the 10th course in the coming June. So what we offer is basically, this is more than a course. It is a mentorship program, as I told you before. So this is a program where our aim is, even the weakest candidate or an below average candidate who comes in should be able to pass this exam if they attend and strictly abide by whatever we tell. This is how we have planned the curriculum. So a below average candidate, if they participate and do whatever we say, we expect a 100% pass for him. Our entire schedule is designed based on a candidate being a poor candidate. Okay, what we do is, instead of straight away bombarding like these intense courses, coming straight to you with a viva, we will be doing it in a very gradual fashion over a period of 3 months. So in the first month, we will be focusing on exposing you to this exam, exposing you to how to talk, telling them what is the right way, and continuously grading them on their performance. Okay, and unlike, again, other intense courses where there is no segregation between candidates irrespective of the specialty, here the moment you enter the course, you will be divided into different groups based on your specialty, and your teaching will be based on your specialty. Again, this is very, very important, because if you are giving a JCIE exam in the UK, 60% of your questions will be in your specialty. There is no point in spending time equally in all the specialties. So you need to spend 60% of your available time in your specialty, and the rest of your time in other specialties. And this course, whatever we have devised, will satisfy those needs. So if you are a colorectal candidate, your 60% of the course involvement will be only in colorectal, and the rest of the 40 will be other things. If you are breast, 60% of your teaching will be in breast, the rest will be the others. And again, even though we have something called as rapid review lectures, we don't have long lectures where someone like me come and put slides and talk like what I am talking today, not knowing what the candidate is taking in. So we have something called as a revision lectures on all the topics, where we come, and it is like a two-way discussion for a period of 3 to 4 4 hours on a particular topic. That is what we do. And our main way of mentoring is learning by doing. Instead of we dictating what we do, we will ask the candidates to perform and then identify them, and we will correct how they perform. This is exactly like a UK driving test again. You start driving, you will sit next to the person, and we will tell, do this, do this, do this, do this, and we correct them. This is what we do. And most importantly, again, unlike any other intense course where the faculty, n number of faculty comes in who doesn't know who is this candidate and stuff, in this course, given that you will be with us for 3 months, by the end of 1 month, I will know in and out of you in terms of your exam preparation. You will know in and out of a faculty. So we will develop a mutual responsibility for each other in to deliver our performance, rather than in any other course where the faculty doesn't have a responsibility that the candidate should pass, or the candidate doesn't have a responsibility to pay back to the faculty. But here we will develop something like a close group of relationship between faculty and the candidate, where each of us will have a mutual responsibility to satisfy the efforts put by the other person. So that's where this one-to-one mentoring comes in. And the accessible team, when I say accessible team, the biggest advantage is when you prepare for this exam, you will have lots and lots of doubts. You will need lots and lots of clarifications or clarities on the topic you need to study. And our way is we will have a closed chat group which is active 24/7. And then if you speak to our colleagues, whoever were in our course before, they will tell you how much we are accessible and how much discussions happening. So you don't need to worry to go and search in an internet to identify what is the right answer or the right treatment. Or you don't need to go and refer the books. You simple thing, put up in the group. Everyone will jump in, we will discuss and come to a conclusion. So we have an accessible team. And most importantly, as I told, whatever resources which I told, we have compiled in a way that what is essential for a candidate. We have compiled a reference library, and whatever sessions which happens over a period of 3 months, whether it is a lecture or whether it is a viva, will be recorded and it will be available in your hand throughout the period of 3 months for you to review what has been taught. So what we offer is we will take care of whatever is the essential knowledge required. In fact, we go 20% more than what is needed for this exam. So if you speak to our colleagues who has participated in our course, they would tell that, oh, they are teaching too much, which is not needed for the exam. But we do it intentionally, mainly because that gives you confidence when you go for this exam, rather than giving the limited knowledge required for the exam. We will make sure your viva skills or verbalization is taken care by regularly assessing your answering skills starting from day one throughout the period of 3 months, and telling you what you are doing right and what you are doing wrong. We will be offering you plenty of opportunities to self-reflect. You will answer in the first week. You will go back and see your videos on how you performed. You learn from others how they performed. Come back in the second week. You correct whatever mistakes you did in the first week. Okay. The first week you didn't study and come. Second week, okay, you study and come. The third week you studied. The second week you didn't focus on the evidences. When you come for the third week, you study evidences also and come. And more than anything, you will be seeing all others how they are performing. So this gives you an continuous momentum over a period of 3 months, and it gives you the push for you to prepare. I know it's very, very difficult, at this part of our life, in this age when we are giving this exam. Sitting and studying and preparing for the exam is so very difficult, with several family commitments, several clinical commitments. Identifying and finding a time to prepare is so difficult. So this program will give you a continuous push and continuous motivation to keep on updating and read something. Even if you don't read anything, there will be something which will be happening in the chat group, which you will be hearing and listening. We will be providing a lot of opportunities to correct your body language. So every response of you, starting from week 1, we will be grading and we will be giving you a written feedback on how you are performing, which will again give you an opportunity to correct yourself. And you can constantly correct yourself and you can become refined. Again, if you speak to our colleagues from the previous course, they will tell, looking at their own performance in the week 1, comparing it to week 10, they will see how much they have improved from week 1 to week 10. And as I told, all resources in one place. You don't need to struggle finding this is better or not. And we will also constantly update during your 3 months period whatever academic activities happening in offered by different societies, so you can register for those things as well. So you don't need to waste time searching for the correct knowledge. Everything happens in one place. Again, most importantly, because we all travel together over a period of 3 months, we know each other, and it gives you a strong networking platform to know each other from different specialities. And this will not only help in clearing this exam, but will also help you in a lot of future job opportunities, writing papers, research collaboration, etc., etc. So this is what we offer. And we have delivered so far 9 courses, and we are about to start the 10th course. We have mentored over 300 candidates. We have 40 plus faculty, and every time we have changed the course based on the feedback we received. And more than anything, our last 4 courses are officially accredited by the Royal College. Ours is the only mentorship program, or I can proudly say ours is the only 3-month program of this much magnitude, which is approved by the Royal College and being officially endorsed. What we had done so far. So this is the results which we had done in the last 2 years. So starting from February 2025 exams, our overall pass rate is 85. UK non-train is 86%, UK train is 94. In the last year international exams, 100% pass percentage, our candidate got the gold medal. September last year, again in JCIE exams, UK non-train is 79% pass percentage, UK train is 97. Same happened in May, and I had put the comparative. As I told, the national average for non-trainees is 44, but what we were able to achieve is 86, 79, 84 so far. The same were there starting from our course initiation in 2022. Similarly, the non-UK trainees as well, again, our pass percentage is far ahead. Again, you should know the number of candidates. So for each course, we don't take more than 30 participants. 30 participants is the maximum limit. And for the last 4 courses since November 2023, our courses has been full with 30 participants. This is what we were able to achieve in the UK in the exams based on our curriculum. So which indirectly tells you that this system works. And we were able to make a difference between 44 and 84. We were able to double the pass percentage of UK non-trainees, and of course, increase the pass percentage of UK trainees as well. So this is what, so I'm not going to waste time in our 10th course details. This is starting on June 8. I know most of you here have already registered. This is the weekend Viva schedule, which again is available in our website. We have an extensive lecture schedule which is available as well. The most important thing and the beauty of our course is at the end of the 12 weeks training program, we have a mock exam which will be exactly like your actual exam, except for the fact that it happens virtually. So each one of you will have an 1-to-1 mock exam, exactly like the schedule which happens in the exam. This is how the schedule will look like. So the mock exam starts at 9:30 in the morning, ends at 9:45 in the night, and there will be 3 rooms which will be continuously running, and the candidate will be coming and moving out exactly like the actual exam. So this gives you a real life testing even before you go to your actual main exams. So this is an idea of how much hours we have spent in each areas of mentorship. So this is the numbers from the 8th course, which finished in the Jan 2025. If you see the amount of hours which were involved in live training. When I say live training, the live sessions. In general surgery, we have spent around 20 hours, critical care 23 hours, which includes both lectures as well as Viva. So these are all the amount of hours. If you see the rapid review lectures alone, it took like 54 hours, and we conducted mock Viva for 94 hours. This is the amount of hours we have actually spent, and this much amount of recordings you will be having in your hand for your revision. So our approach is we will give a feedback bluntly. I have personally told many candidates 1 week prior to the exam or 2 weeks prior to the exam not to give this exam. We will tell them very clearly you are not ready for the exam. We will grade the candidates from day one, telling what is right, which they are doing, and what is wrong, which they need to correct. There will be a lot of opportunities for correcting your Viva practices. The groups are kept intentionally small so you get more one-to-one attention. We have lots of opportunities for a one-to-one mentorship. We identify candidates. We will tell them that, look, this whatever participation in the course alone is not enough. You are very, very weak. You need additional sessions. These are things which we could offer. It's up to you whether you choose or not. And we will train them how to answer, what to answer and what not to answer within the time frame of 15 minutes or 20 minutes, and the actual mock exam which replicates the EC exam. This is how we um, assess you from day one. From day one, when you start answering our practice waivers, each of you will be assessed by the faculty and a mark is given. We will be telling how you performed overall, how is your overall professional capability, what is your knowledge and judgment, what is your quality of response, and we give a comment. So as I told, the course is for 3 months. At the end of the first month, you will get a report like this. You'll get a report like this stating that these are all the waivers you attended. These were all the faculty who assessed you. These were the topics. This is your rating and this is your feedback. You can see here good presentation and delivery. You will no issues. You will get better as the course goes. Performance very well. Basically we give comments on everything, telling what you need to do, what you should not do, what is right and what is wrong. Similarly, we will give you an attendance report also. This is again is very, very important for you because at the end of the course, we provide you the Royal College CPD points equivalent to the number of hours you were actively participating in the course. So if you have participated in all the 100 hours in the course, you would receive 100 CPD points offered by this. So this acts as your performance certificate as well as the attendance certificate. This is how your mock exam results will be provided. At the end of the mock exam, again, exactly like how you get your actual exam results, we will be giving you, okay, general surgery, this is your marks, again, feedback on all these things. Having looked at all these things, Royal College have always appreciated our efforts, and I always thank Royal College for providing the credibility for the course and whatever efforts we had put. All the feedback submitted by the candidates are directly submitted to the Royal College then and there. Last slide. Apart from whatever we have discussed and the multimodal way of educating and mentoring the candidates, we have our learning management system, which is also called as an app, which you can call, which is available both in your desktop as well as your mobile phones or tablets, where everything is recorded and it is available with you anytime. You can download the videos within the app, and even if, say, you are flying from somewhere where you don't have a network, you can listen to those things and stuff. Apart from that, we will be having a Telegram group. Okay, again, Telegram group will be created for a particular. This is a snapshot of an 8th FRCS course where all the members will be there, and we will be segregating the Telegram group into individual subspecialties. And from day one until the day you finish your exam, there will be a constant discussion which will be happening there. We'll be putting images, we'll be asking you questions. And for example, a simple thing, say radiology, if you see there are 537 messages are there. Usually we cross more than 5,000 messages at the end of 3 months. There will be 5,000 interactions which should have happened in the Telegram group, which is constant. Okay. So this is all which I wanted to tell about this exam. So the aim of present day meeting is to give you an overview about this exam, how to choose your resources properly, and also to tell what we could offer. And before I conclude, if you have anything related to the course or something, you feel free to contact us through emails or websites, or you can WhatsApp us. But at this point, I'm open to any questions which you all have. Any questions, guys? Anyone have any questions? No? No one has any questions?
Money.
Yes, Hassan.
Yeah, the program for this June 10th FRC exam is finalized or is not?
It is finalized. It is finalized, and we will put up the updated schedule by next week. By May 25th, you will have the final schedule.
Okay, thank you.
Yeah. Any questions, guys? Anything related to the exam or preparation? Any questions? No? I hope this session was useful for you guys. Yeah. Generally, I tend to get a few questions. Yes, Harsha, tell me, Harsha. Finally, someone has raised the hands. Harsha, can you unmute yourself? Harsha? Sorry, I think you are unable to. You can put up your question in the chat if you can't. Okay, fine. Right. If you don't have any questions, probably we can wind this session, and this session will be recorded and it will be available for everyone to access if at all, if you want to go through it. And if you have any questions related to the exam, feel free to put up in our preparation group. I hope most of you all are there in the preparation group where you can put. If you are already a course participant, we have already created the WhatsApp group for the course, and we will be providing the accesses to the library by May 25th. May 25th, we'll be providing the accesses to the library, as well as we'll be finalizing and putting up the schedule as well. Right. Thank you very much, guys. Thank you for your time, and I hope this session was useful to you, and you all would be benefited out of it. Thank you very much. Thank you.
Thank you.